Well, my name's Lane Strathearn. I'm the Division Director for the Division of Developmental and Behavioural Pediatrics, and I'm also the Physician Director of the Centre for Disabilities and Development and the new Intellectual and Developmental Disabilities Research Centre. The Division of Developmental and Behavioural Pediatrics works within the Centre for Disabilities and Development and, of course, the UI Stead Family Children's Hospital. But we have a close relationship with the Centre for Disabilities and Development that allows us to expand our reach from just clinical care to research, to education through the LEND program and community outreach. So the Centre for Disabilities and Development also has a decade-long program that's federally funded called the University Centre for Excellence in Developmental Disabilities. So while we're able to provide excellent clinical care for families, we're also able to help them reach out into the community to receive the resources that are needed when they go home, when they're on their own. So from the tripartite mission of clinical care, research and education, I think the one that resonates with me most strongly is research. And that goes back to my fellowship training in Australia. I was seeing patients with very challenging behavioural and developmental disabilities, and I realised that there was a limit in what we could do to actually help these families. And it was hard, it was difficult for us as clinicians, but also for the individuals themselves and their families struggling with these different challenges. So that led me to ask questions to say, do we really understand where these challenges are coming from? And if so, would that help us to better know how to intervene early and perhaps prevent some of these difficult challenges? So that's the exciting part about research. We can look at where we are currently and we can ask questions to open up new avenues of inquiry and possibly new avenues of treatment. I think the thing that prepared me best to become a Division Director in Developmental Behavioural Pediatrics was my love of kids. So I have a family of 7 children myself, most of whom have left home now, but I've always loved being around children, working with children, and I've seen in my own family developmental change and developmental problems. We've had our own challenges within our family. So I think that personal experience has helped me in my role as Division Director and given me the motivation to do the work I do. I think all of our physicians and psychologists love teaching, they love being involved with learners, and I think that comes through. So we have what's called the LEND program. So all of our developmental behavioural pediatrics fellows spend 1 year of their fellowship in this program that stands for Leadership Education in Neurodevelopmental Disabilities. So that provides our trainees with this very broad experience in working with families with disabilities. And that includes meeting families, going into their homes, advocacy, working with government representatives, advocating for individuals with disabilities. And we have trainees from all different disciplines, from social work, public health, administration, the therapy, psychology. So while they're training themselves, they're also interacting with people from all different disciplines. And I think that's a tremendous bonus of our fellowship program. We also have a psychology fellowship program, and again there's this great interdisciplinary field working with others from different areas of expertise. A focus on research, developing those skills to ask critical questions, and that enables us to find answers that benefit families and individuals. I think the working culture at UIHC is overwhelmingly collaborative. That's what I've experienced since coming here. I find that people are very open to understand new ideas, to think about new directions, to work together. We learn a lot from people from different backgrounds, and it means listening, it means trying to understand it, it means looking at things from a different perspective, and I think that's how we grow as a division.